let's welcome U.S. Attorney Damon Martinez.
Well, good morning. Dr. Weiss, thank you for that very kind introduction. I would also like to thank CNM for allowing us to use this facility this morning. What a wonderful place to meet. I want to start by thanking Commissioner Maggie Hart Stebbins and her team for their leadership in confronting the crisis posed by the opioid abuse, and not only in Bernalillo County, but throughout New Mexico. I also want to thank the coordinating committee for the Bernalillo County Opioid Accountability Initiative, including Dr. Weiss, Dr. Harris Silver, Marcia McCurry Avila, and for all that they have been doing every day for the past 4 years to forge safer and healthier communities in New Mexico. Thank you also for including the U.S. Attorney's Office and the UNM Health Sciences Center in this initiative, and for giving Chancellor Roth and me the opportunity to participate in today's summit. It's for the purpose of discussing how our organizations can contribute and to build on the good work that is already being done here in Bernalillo County. Let me start by telling you that Chancellor Roth and I recently agreed to have our organizations collaborate on which we are calling the Heroin and Opioid Prevention and Education Initiative. In short, we call this the HOPE Initiative. Now, although the HOPE Initiative will gradually be implemented statewide, we decided to begin implementation here in Bernalillo County because we know we can capitalize on the infrastructure provided by the county's initiative. The county's initiative already has brought together many experts, advocates, leaders, and other critical stakeholders from our public health, research and education, law enforcement, and substance use disorder prevention and treatment communities who are dedicated to confronting heroin and prescription drug abuse. Your commitment to improving and saving lives is inspiring, and the guidance and expertise you bring comes at a time when much is at stake. You know the challenges that we face are daunting. You also know that it makes sense to focus on the most dangerous types of drugs. And right now, few substances are more lethal than prescription opioids and heroin. Between 2006 and 2010 across America, heroin-related deaths increased by 45%. During that same time period, here in New Mexico, the increase in heroin-related deaths paralleled the national increase, but at a rate that was 2 times greater. These shocking statistics, which do not include death resulting from prescription opiate abuse, are clear indications that we are up against an urgent public safety and public health crisis. This is a crisis that affects Americans in every state, in every region, and from every background and walk of life. Accordingly, the overriding goal of the HOPE Initiative is to reduce the number of opioid-related deaths in New Mexico. The HOPE Initiative is an integral part of my office's implementation of the Federal Smart on Crime Initiative, announced by the U.S. Attorney General in August of 2013. This nationwide initiative seeks to achieve better outcomes throughout the federal criminal justice system, especially with regard to nonviolent drug-related crimes. In recognizing that we cannot simply arrest our way out of the drug problem, while effective law enforcement will always play a critical role in protecting our cities and neighborhoods from drug-related crimes. Reducing crime requires a broader, multidimensional approach. Science clearly demonstrates that addiction is a progressive disease of the brain that can be prevented and treated, and from which people can recover. With this in mind, we must treat substance abuse and the disease of addiction as a public health issue, not just a criminal justice issue. Accordingly, under the Smart on Crime initiative, the Justice Department is focusing federal resources on investigations and prosecutions that serve a significant federal interest, while strengthening diversion programs and community service initiatives that provide alternatives to incarceration for some individuals and offer treatment and rehabilitation to those who need it. It strives to improve and reinforce reentry programs and initiatives so that formerly incarcerated individuals can return to their communities better prepared to become full and productive members of society. It recognizes that education, prevention, and treatment, along with vigorous law enforcement, must all be significant components of any comprehensive solution. It also calls on all U.S. attorneys to modify their charging policies to ensure that stringent mandatory minimum sentences are reserved for the most serious criminals, and that those who commit low-level, nonviolent crimes will face sentences appropriate to their individual conduct. When I was confirmed as U.S. Attorney in May of last year, I made implementation of the Attorney General's Smart on Crime initiative one of my top priorities. The HOPE initiative is a key part of the implementation of the Smart on Crime initiative here in New Mexico. The HOPE initiative is comprised of 5 parts. The first part is prevention and education. The second part is treatment. The third part is law enforcement. The fourth part is re-entry programs. And the fifth part is strategic planning. The U.S. Attorney's Office has long participated in prevention and education programs, and it will expand on these efforts as part of this initiative. It also fully supports efforts to expand on available treatment options. Today, however, I will touch on what the U.S. Attorney's Office is doing with regard to the HOPE initiative's re-entry and law enforcement components. And Chancellor Roth will discuss the prevention, education, and treatment components of the initiative. Under our Project Safe Neighborhood program, the focus is on the urban Indian community in Bernalillo County. We are working with the Pueblo of Isleta to establish one of the country's first re-entry programs in Indian country. This program is a pilot project for Pueblo members who are returning to Isleta Pueblo after being incarcerated in federal, state, and juvenile facilities. The program seeks to ensure that re-entering Pueblo members have access to education, housing, and employment, in addition to the substance abuse treatment and counseling they will need so they can successfully return to their communities. These components are also critical to avoid relapse to addictive behaviors and to reduce the likelihood of recidivism to the criminal justice system. The Isleta Pueblo Reentry Program is our first step into the reentry arena. We intend to expand our reentry efforts to other pueblos and tribes, as well as support the state's reentry programs. To facilitate this expansion, in April of this year, we will partner with the Department of Justice's Bureau of Justice Assistance to host one of 3 Indian country reentry training programs that will be offered to tribal communities throughout the country. We will encourage New Mexico's tribal leaders to participate in the training as preparation for establishing reentry programs in their communities. The law enforcement component of the HOPE initiative also makes clear that the U.S. Attorney's Office will never waver in its commitment to act aggressively to keep our streets safe and our children free from drug addiction and abuse. It makes clear that we will never stop being tough on crime and the choices that breed it. But it also recognizes that we must be smart, efficient, and effective as we strive to disrupt and diminish the scourge of addiction, along with the underlying conditions that trap too many individuals in our vicious cycle of drugs, criminality, and incarceration. We will focus our law enforcement efforts to combat the opioid abuse problem in New Mexico against the backdrop of the broader goals of our Organized Crime Drug Enforcement Task Force program, which is known as the OCDETF program. These goals include identifying, disrupting, and dismantling the most significant criminal organizations responsible for the manufacture and distribution of heroin and illegally trafficked opioids. They also include facilitating the coordination of law enforcement efforts against heroin and opioid traffickers and dismantling the financial infrastructure of these criminal organizations. To achieve these goals, we will continue to target cartels and other drug trafficking organizations that have significantly expanded their production of heroin and its distribution in the United States, as well as the heroin traffickers who have expanded into areas with existing prescription drug abuse problems. Focus on the cartels and the drug trafficking organizations is imperative because the amount of heroin seized along the southwest border increased by more than 320% between 2008 and 2013. Our situation, however, is not simply a problem of drugs crossing our borders or another country's bad actors harming us. It is our problem. Practitioners who illegally dispense prescription painkillers, those who operate pill mills for prescription painkillers, and pharmacists who fill fraudulent prescriptions while knowing their true purpose are drug dealers, no different from street-level heroin dealers. And so we will also investigate and prosecute prescription drug diversion schemes, pill mills, rogue clinics, pharmacies, and prescription drug rings. In conjunction with what we call our Worst of the Worst initiative in the U.S. Attorney's Office, we will continue to work with our local district attorneys to target heroin and opioid traffickers with prior convictions for federal prosecution with the goal of removing them from our communities for as long as possible. This year, Albuquerque has experienced a sharp increase in the number of pharmacies robbed at gunpoint for opioid painkillers. These offenders will also be targeted under the HOPE initiative. We will continue to work with corrections officials to investigate and prosecute those who interfere with and obstruct rehabilitation and treatment efforts within custodial settings by introducing drugs into our prisons and jails. Now, the law enforcement community's commitment to the HOPE initiative and to Bernalillo County's initiative is apparent by their participation and present at today's summit. I would like to introduce some of them to you. So if, once I mention your name, if you would please stand. First, I would like to recognize Sean Waite, who is an Assistant Special Agent in charge at the DEA. I'm going to name a few here, so if we could just hold on applause till I'm done with the few that I'm going to introduce. Renee McDermott, she's an Assistant Special Agent in charge of the FBI. Okay, we can have a couple of claps. Cabinet Secretary Greg Farad of the New Mexico Department of Public Safety. Albuquerque Police Chief Gordon Eden. Bernalillo County Sheriff Manuel Gonzalez. Now David Martinez, who's the Deputy Chief of the New Mexico State Police. We have from the Homeland Security Special Agent Abby Keth, let's see, you're over here. Deputy U.S. Marshal Mitch Varley, over here, thank you. And we also have Chief Kevin Mariano of the Isleta Pueblo Police Department. So there's other officers in the audience today, and I would ask too if you would stand. And I understand that there's some folks here from the DA's office, is that right? Okay, if you would please stand, and what I'd like to do is just give you a hand, because these are the forces, these are the people who are on the front line of, they're the ones who work the undercover operations, they're the ones who literally put their lives on the line on a daily basis. So if we could give them a hand, I'd appreciate it. The agencies represented by these fine men and women are committed to thoroughly investigating drug-fueled crime and violence. And the U.S. Attorney's Office will vigorously prosecute these cases. Now, as I earlier mentioned, the crisis we face is not just a crime problem. It's a community public health problem. Whenever people look at this problem, they come to the same obvious conclusions. One, there is no simple answer. Two, we cannot stand by and do nothing. And three, we cannot arrest and prosecute our way out of it. And four, the stigma associated with the disease of addiction helps perpetuate the problem. This crisis demands that we join together to employ a comprehensive strategy that addresses every aspect, every phase, and every cause of this crisis. As elected and appointed officials, law enforcement officials, medical providers, and prevention and treatment experts, each of us stands on the front lines of the effort to protect our communities from the devastating impact of illegal drug use. Together, through collaboration and cooperation among stakeholders at every level, we can make significant strides to build a better, brighter, and more secure future for ourselves and our children. Now, before turning the podium over to Chancellor Roth, I want to mention a couple of related matters that I think will be of interest to you, that actually one of them was already mentioned earlier this morning. First, last year the U.S. Attorney General announced that federal law enforcement agencies, including the DEA, FBI, ATF, and U.S. Marshals Service, are to review their policies and procedures to determine whether their agents should be equipped and trained to recognize and respond to opioid overdose, including the use of Narcan. This announcement paves the way for federal officers to begin carrying and dispensing this life-saving drug. Now, we cannot overstate the importance of Narcan to our core mission of saving lives. From 2008 to 2014, the number of documented overdose reversals with Narcan tripled from 250 to 800. A Narcan program established by the New Mexico Department of Health can be fairly credited for saving these lives, as it was mentioned earlier. But soon, federal officers will join this life-saving effort. Second, last month, the Department of Justice announced a new national heroin initiative under its OCDETF program. The primary purpose of the National Heroin Initiative is to provide funding to support local and regional initiatives like our HOPE initiative and the Bernalillo County Opioid Initiative in developing coordinated law enforcement plans to disrupt the flow of heroin into communities that have been profoundly impacted by heroin trafficking and overdoses. We will move expeditiously to secure some of these resources and put them to good use here in New Mexico. Finally, the Department of Justice and other federal agencies periodically offer grants that fund community-based coalitions that organize to prevent and treat substance abuse. Now, you may have met him this morning, but one of the folks in the U.S. Attorney's Office who's instrumental in working on this type of issue is Ron Lopez. Ron, are you here in the room? I'm asking Ron to stand up because if you're, as we talked about talking during the break points, if you're part of putting together a proposal or a grant application, Ron is the person that can help you out and advise, or he could be a point person for our office. So I just wanted to point him out in case you want to track him down during one of the breaks. So, in closing, I remind you of the obvious. Progress will not come easily, and positive change will not occur as quickly as we might like. But as long as we keep our commitments to one another, as long as we keep seeking new ways to work together, as long as we keep striving to build on the promising work that so many of you are leading, there is good reason for confidence in where these efforts will take us from here. I am proud to count you as partners in the considerable work that lies ahead, and thank you for all that you're doing today and every day to combat drug abuse and to protect our young people. I look forward to next year's summit when we will discuss what we have accomplished together in 2015 through the county's initiative and the HOPE initiative, and to continue to develop positive strategies for the work that must be done. Thank you.
I'd like to now introduce Chancellor Paul Roth. After Dr. Roth's remarks, we'll have a bit of time for some Q&A. I apologize, we're running a few minutes late, but please bear with us. This is a very critically important part of our program. I'd like to note that Dr. Roth's resume is about as long as they get. He's done a whole lot, and much of that has been since he's been based, almost all of that has been since he's been based here in New Mexico, now over 25 years, going on to 30. He's been a major force in New Mexico and nationally. His summary is in your packet. I'd like to highlight just a couple of things. One is, because I'd like to maybe come back to this during discussion, he describes himself, as I understand it, as an innovator and an entrepreneur. So we need to keep that in mind, because it's true, because he's done a whole lot. And it's not that he's just sort of moved into positions, he's built the positions he's moved into. And that includes the entire emergency medicine program he assembled and moved on to a national platform beginning at UNM. And he's been the founder of disaster medicine at UNM, which has had also a major real-time, real-world impact in significant disasters in the country. He's also served on many advisory councils. His insights into this and his team's creativity in coming up with solutions in disaster situations. Dr. Roth.
Thank you, Bill. What Bill didn't say is that he was the one who hired me at the University of New Mexico. And sometimes I don't know if he regrets that or what, but that is the case. Part of the fact that I have this experience in disaster medicine was a prerequisite for the job as dean of the medical school. It's certainly come in handy. And I think you're right, Bill, that anytime there is a need that outstrips capacity, it's defined as a disaster, and that's exactly where we find ourselves today. I'd like to thank Damon for all of his remarks. It was great to visit with him back in August when we decided that we would take on this initiative, and I was absolutely convinced, U.S. Attorney Martinez, that you will do whatever it takes and whatever resources and efforts are required to move this initiative forward. It's also important for me to give special thanks to Commissioner Maggie Hart-Stebbins, who is the leader of this effort on the County Commission and for the county, and obviously those of you who are part of the Bernalillo County Opioid Accountability Initiative. I enjoyed Dr. Silver's comments earlier, and I learned a lot from Marcia McMurray Avila's references, and I think the way that we can all join together and see some substantive and meaningful outcomes will be essential. And obviously Bill's participation in that. When we spoke last August, the U.S. Attorney and I, and I have to say that it was the U.S. Attorney that called the meeting. He was very interested in pursuing this as part of Mr. Martinez's Your Initiative here in New Mexico. And again, I was absolutely blown away by his enthusiasm and commitment for making this thing work. And as he said, we have greatly appreciated the opportunity for both he and I to be here today. Now, I do realize that it's hot in this room, and I am standing between you and the break. So I'm going to try to go through my comments a little as quickly as I possibly can. I'm here to talk to you a little bit about what the UNM Health Sciences Center does in the array of programs. Most of you in the room, I think, are familiar with what we do. As I go over those, I'll talk a little bit about places where we hope to expand some of the initiatives that we currently have underway. But we have a lot of folks from UNM here, and I wonder if I could, as the U.S. Attorney for his folks, I'd like to have everybody from UNM, if you could please stand up. We have folks from the Mental Health Center, from CASA. So these are, when we talk about moving from the 30,000 foot to on the ground, these are the folks that make all these things happen. Now we have a number of programs. Every day our doctors and nurses at the Health Sciences Center, particularly at the state's only psychiatric emergency department and our other subspecialty clinics, see patients suffering from substance abuse every single day. And as our providers will, as you know, our providers understand what the human toll is that addictions exact on families, loved ones, and the community at large. Indeed, the addiction to opioids in both prescription and street drug form is one of the most insidious and devastating public health problems that we encounter. And tragically, opioid addiction and consequent overdose deaths plague New Mexico more than any other state. And I guess this is one of those things where we are happy when we move to the 49th. And so West Virginia beat us out at the 50th spot recently. But if you look back over this throughout the 2000s, we've consistently been the very, very highest in this regard throughout the country. And I think we're estimating that about 15,000 adults in Bernalillo County have a diagnosable opioid condition, but the problem is that only about 25% of them are actually receiving any form of treatment. The high rate of opioid addiction and overdoses is related to a variety of factors, and many of our speakers earlier talked about those, so I will not be going through that. But I would like to hit some of the specific programs that we have at the Health Sciences Center. First, let me comment on Project ECHO. I think one of the previous speakers talked about the need for effective training. And of course, that is not just in Bernalillo County, even though that the numbers for our county are the highest, but it's also even a more difficult challenge in rural areas of the state where they don't even have as few resources as we have here in Bernalillo County, where you have a lone nurse practitioner working with a family in which a family member has a substance abuse problem and no resources. Project ECHO, as many of you know, is this telehealth and telemedicine program that we created at UNM. Dr. Sanjeev Arora has received international acclaim for how it reaches out to needed areas, particularly in rural areas in New Mexico, but he has programs throughout the United States, the VA hospital, India, several other countries, including in Africa and in Asia, where they have these joint teleconferences where patients are presented. There's a conversation with subspecialists at UNM about how they would manage those patients. And two things happen. That particular patient is more effectively treated, but it's also a learning experience, and they get CME credit, and then all the other people who tune in on that teleconference learn how to manage a particular patient with those similar kinds of needs. Now, we want to expand this program. Unfortunately, Project ECHO was cut $1.5 million during the recession. We've been fortunate to get some of that back recently. Our hope is to go back to the legislature and get the balance of that funding restored, but last time I looked at oil prices and the ability for the state to come up with huge dollars, it's creating a little more anxiety in me, and I don't know, Tim, if there's a part of my brain I need to be focusing on to help me with that. This also, we want to expand Project ECHO and some of our telemedicine programs to include not just the specifics of treatment for an individual with addiction, but also to focus on more community ideas like prevention that will help us in a much more effective way as well. And I appreciated, Dr. Condon, your presentation and the discussion. I actually learned quite a bit there. Part of CASA, it used to be many, many years ago, CASA was combined with the treatment piece of addiction called the ASAP, the Alcohol and Substance Abuse Program. That was split many years ago, I think before Dr. Condon came on board, but we are responsible at the Health Sciences Center for the treatment piece. And at ASAP, we have over 100,000 visits a year treating individuals with substance abuse. Most of those visits is in methadone treatment, but there are other types of longer-term and prevention kinds of treatment programs there. I just want to mention the New Start ASAP program, which is a program that began, a 12-week program that targets women with 2 hours of treatment contact every week. The program uses a proven skill-based cognitive behavioral format, and we also provide individual sessions with primary counselors for those folks. ASAP also has an ambulatory detoxification program. We talked about detox. Historically, usually you do detox in severe cases in the in-hospital setting because of the medical adverse effects that are associated with withdrawing from certain medications. But the ASAP has perfected a method to do some of that in selected patients on an outpatient basis. And it's designed to provide that medical assistance without having to admit individuals to the hospital. The Dual Diagnosis Clinic at ASAP provides ongoing therapy, psychiatry, and nursing care to patients diagnosed with co-occurring substance abuse and psychiatric disorders. Patients may receive methadone or Suboxone treatment if clinically indicated in that setting. And it also operates in ASAP, a primary care clinic, realizing that it's very difficult for these patients to make multiple visits, first of all, but know that people with substance abuse problems have general medical issues just like all of us in this room, and making a convenient one-stop shopping for those individuals we felt was important. So we've opened up a primary care clinic in that ASAP clinic. Another HSC program that's dedicated to reducing deaths from opioid overdose and in reducing the burdens of morbidity and involve the Milagro program. I think most of you are familiar with that. That began many, many years ago. It started in 1989 and it was the first program in New Mexico that focused on pregnant women with substance abuse and addictive issues. Milagro now has served about 2,000 women this year, and over the last several years. The program, we hope, will be able to expand. We're hoping that through the efforts of this conference, we'll be able to identify partners here that will help us identify ways in which that particular asset for the community can expand. The Milagro program enrolls any pregnant woman with current or past substance abuse issues. And there's medication-assisted treatment available to women with addictions to opiates and heroin through the use of buprenorphine or methadone. The team provides also follow-up for women, so that, as was mentioned earlier, this is not just, you treat it once and then the problem goes away. This is a long-term treatment for women with this problem. The program also works closely with the FOCUS program at the Center for Development and Disability to make sure that the families that are affected with patients in the Milagro program are also receiving ongoing therapy and care because, as you know, the impact to family, the immediate core family and the extended family is very extensive. And with that in mind, the FOCUS program is a big supplement to the Milagro program. I found it very interesting when I was preparing for this presentation. One program I didn't even know about was a program in our College of Pharmacy called the Generation RX. And this is a national program. UNM chapter is sponsored by the American Pharmacists Association, and it began as a grassroots program in 2007. It started with one College of Pharmacy faculty member and a handful of those students who were passionate about educating the community on the dangers of prescription drug misuse and abuse. Their efforts have grown to include educational programs targeting people of all ages, as well as social media and local billboard campaigns. UNM's Generation RX chapter has been recognized nationally on 3 occasions for its innovative approaches to educating New Mexicans regarding the dangers of prescription drug misuse and abuse. Overall, our pharmacy students have presented educational programs more than 300 times, often to gymnasiums packed with students, middle school, high school students. The students, with the support of the faculty, have also collaborated with multiple entities statewide, including the New Mexico Poison and Drug Information Center, the Albuquerque Public Schools, the New Mexico Heroin Awareness Committee, Safe Team New Mexico, the Bernalillo County Juvenile Detention Center, and New Mexico Children, Youth, and Families Department, to name just a few. Although we have many resources in place, much more needs to be done, and we all need to work in partnership together to make sure that we achieve the kinds of goals that we believe are meaningful and sustainable. One thing that we are now just beginning to implement, I don't know if you're all familiar with this concept of a medical home. It's the idea of a primary care clinic that's more than you just go to see your primary care doc, but it's a more expansive notion. It's actually supported out of the ACA. And so when a family shows up to their medical home, they will be managed for prevention, for wellness, for treatment of their medical conditions, whether that's acute or chronic. But it's also there to consider other forms of treatment. So we are adding behavioral health to the medical home model, which is a first in New Mexico. Our new chair of the Department of Psychiatry, Mauricio Toin, in fact, has even changed the name of the department from the Department of Psychiatry to the Department of Psychiatry and Behavioral Health, because the role of social workers, clinical psychologists, and other providers are essential, particularly in the way in which we plan on using these providers in the medical home. So we've talked about a lot of problems associated with substance abuse and addiction and all of the horrors that are connected with that. But at the same time, we need to keep in mind that opiates are actually a useful drug. We use it for the treatment of both acute and chronic pain. So it's not like we should just ban narcotics. They have a very effective role in the management of some very, very difficult cases. And I think Dr. Silver referred to our UNM Pain Center. And I don't know if Joanna Katzman is here, but Joanna, would you stand, please? Joanna is our director for the Pain Center. It's the only chronic pain center in the state of New Mexico. It's an NIH-designated center of excellence in pain education as well. And it's now treating more than 7,000 people a year throughout the state, regardless of their ability to pay. And it's also the only dedicated pediatric interdisciplinary pain program in New Mexico. We very well understand how chronic pain can come to rule our lives. And in the social groupings that had been discussed earlier, very often there are individuals who have no intent when we talk about choice. They didn't choose to have pain, but they find themselves in a setting where they become addicted to that medication, because without doing that, it's not just to feel better, but they will be in excruciating pain if they do not get some form of treatment. That is what Joanna and the faculty and staff at the Chronic Pain Center try to do every day. And I was going to go on and on about what the Pain Center does, but I'm sweating up here and it's very hot. So I'll let that go, but leave it to say that what we are hoping to do again this legislative session is to request expansion of the UNM Pain Center. We feel that there needs to be more providers within Bernalillo County to allow for greater access to that resource, but also to use Project ECHO and other telemedicine programs to reach out throughout the state and help local providers manage this, again, this very complex medical problem while keeping the individual at home and with their own support system at that point. So we are asking for about $2 million. If you know any legislators in New Mexico, I think the governor, by the way, is also very supportive of this initiative, and we appreciate her support. And in closing, I just want to say that today's summit really is, I hope, a promise for collaboration with all of the stakeholders in this room and throughout, and those not even here, but in our community, to tackle the challenge of the scaling evidence-based interventions up to have a population-wide impact. The science of population health, by the way, being able to really understand what intervention, to have the data systems, the information systems, to effectively understand baseline, and then to understand the intervention and to track that intervention over time is a whole new science. When we talk about complex and complicated systems, that's huge. And in many settings, they don't even have computer systems that are designed to manage that kind of sophisticated analysis. We happen to have that in our institution, and we're building the science of population health as we speak. So from my perspective, neither the U.S. Attorney nor Maggie and the county commissioners in the county, nor the mayor, R.J. Berry in the city, nor I can do this alone. Everybody in the room, and we've talked about this, Marcia talked about this, everyone has to be working together to achieve this, a successful collective impact. And the way that we can measure it, though, so that we can demonstrate whenever there is public funding that we might seek, and to convince those who are the policymakers in this country and in our state, in our county and city, that those dollars actually resulted in something better. They demand evidence-based for them to continue that kind of funding. And we would like to help in providing the kinds of resources necessary to make that a fact. So I look forward to all that's going to be accomplished today and over the course of this next year. And when we get together next year, and we'll be wishing you another Happy New Year, that it'll actually be a Happy New Year, because we'll have looked back and found that we've really done something special as a result of this summit. So with that, I'd like to thank you all again, and hopefully Bill will bring us on a break and we can cool off.
Okay, we're going to try to catch up. What I'd like to do is allow for 5 minutes of any comments or questions. Nowhere near enough, but if anybody, we'll just cut it off at 5 minutes, and then we'll take a discussion break, and we'll then come back with prevention. And the discussion break means you can also use the restrooms and have some coffee, but above all, talk. So, we've had just 2 extremely important presentations. Anybody want to say anything? We'll open the microphones on either side here for brief comments.
Is available in a tablet form that can be prescribed long before there ever is an overdose. And there's also a 30-day extended form that can be given long before there is an overdose. So what I propose, and what we've been starting, is that when we have patients in the hospital, when they've gone through the ICU, when they've gone through the rigorous experience of being in the ICU because of their substance use, why don't we, before we release them back out into the world, give them this medication so that this can prevent the overdoses that we've all been talking about in this room today. So I know there are some prescribers out there who can prescribe this, who do prescribe this. I'm just putting it out there as a possible suggestion, because then maybe we wouldn't have to have so many conversations and body counts for people who have actually overdosed on opiates. And that's all I have to say.
And the name of the drug is?
It's naltrexone. It is chemically the same as Narcan.
Good morning, I'm Dr. Moviglia. Thank you, Bill, for, I thought you would ignore me, but thanks. And the reason is because I'm representing a managed care company, so I would understand that. I'm kidding. The question, though, goes back to the involvement of managed care companies who are handling the Medicaid populations. Not to be critical of the forum, but I think that this is a missing aspect in your conference. And I hope that in the future we can find a way to cooperate more. Because in reality, we offer services like coordination of care, integration of care, that are really pivotal in affecting proper care, and actually affecting proper care at the community level, because we don't want an episode to escalate. We want people to be treated in their own communities when with the appropriate natural support systems. So that was my comment. Thanks.
Thank you, Marcello.